Hello, everyone, and welcome to OT Echo. I am so excited today because Mary Musyoki, one of our longtime members of our International Mentorship Program, is presenting today on mental health and wellness psychosocial support with her experiences in Kenya. So thank you so much for coming. Please keep yourselves on mute, and Mary will answer questions at the end. Mary, take it away.
Thank you very much, Kate. My name is Mary Musyoki. I'm an occupational therapist, a pediatric occupational therapist. I'm also a member and mental health program manager with Therapists Beyond Borders. And then I'm also a certified member and an ex-team member of special education professionals in Kenya. And currently, I'm working at University of Gonda in Ethiopia as a clinician and a lecturer. And I'm happy to talk today. This topic is really wide. You can see previously we had community-based rehabilitation and mental health, which was really broad, and we could not be able to fit it in our discussion today. So today, majorly, I'll look at mental health and wellness, providing psychosocial support for caregivers of children with disabilities. So the reason we are specifying is because the patients or the children that we work with their caregivers and their parents, we are normally not aware of their psychosocial or their mental stresses that they go through in bringing up a child with disability. And so it is a venture that we as occupational therapists, we need to be very keen on, because we always say we are treating the whole family, we are being holistic. So considering caregivers and parents, it's one of the major part of we need to play as occupational therapists. Yeah, so I've given you my profile. Kelsey, we can move to slide 5. So from slide 2 and slide 4, we have different workshops that we have been able to do, psychosocial the workshops that we've been able to do, one in Somaliland and the other one was in Kilifi in Kenya, which is a very low income area, and most of the people, persons and children with disability do not access health services. So it was really important for us to go and work with them. So briefly, I want to talk about TBB and special education professionals. So special education professionals is an NGO in Kenya which works in the community. So it majorly does community-based rehabilitation, and it works with low-income area people or population, dealing with children majorly, and psychosocial support for the caregivers has also been part of it. And Therapists Beyond Borders is an organization which is international, which was founded majorly around before COVID. And during COVID, the organization decided to train clinicians to provide psychosocial support for people during COVID time. And after post-COVID, we thought of tailoring the education or whatever we were taught to dealing with our population, with children and parents and people with disabilities in Kenya. And so it has given me, it has spearheaded my passion in mental health. And here we are. So if we briefly look at what mental health, we always think of mental health as being stable, being able to talk to people, being able to analyze your situation, and being able to find solutions to your situations. So having mental, as occupational therapist, mental health is pretty important for us. because when we are engaging in occupations, we need to have a stable mental health. So if we look at parents of children with disability, mental health is really important because now these parents, they will experience distress with raising up a child with disability and also dealing with the community stigma, no support around the community. So when we look at their mental health, this is missing. That may lead them to not be able to engage in social activities, not to be able to do their productive life because they are taking all their time to deal with children, with their child, taking care of their child. So in these six facets, we see that for one to have a stable or be said they have stable mental health, they need to be able to form and maintain healthy relationships, being able to develop empathy for others, being able to express emotions and beliefs, being able to communicate and develop self-esteem or a sense of personal worth. So either one or two or even all the facets that we see here for parents of children with disabilities, it is affected when it comes to their life or their mental health. So with time, I've been able to slide 6, okay? With time, I've been able to think of the intensity of psychosocial support that we need to give around persons with disabilities. And it's a concept that I've developed over the time dealing with the parents. And looking at it, we have the centerpiece being the person with disability or child with disability. Then we have level 1, level 2, and level 3. So slide 7, Chelsea. At level 1, it is the immediate family or the caregivers, meaning maybe if it's the child with disability, their father, their mother, or their sibling, and if it's the person with disability, their spouse or children, they are in the first level of the tier. And then in the second level, we have the extended family, uncles, grandparents, or cousins. Then in the tertiary, we have service providers like us, the OTs, the PTs, the special needs teachers, church members, school peers. So it goes on level 3. Next slide. So beyond level 3, we have the tertiary. We have beyond tertiary, we have the policymakers like the government. And how I brought about this concept is that people who are near the child need more or intensified psychosocial support because they are next to the child, yeah. And then as we continue growing in the tier, the intensity reduces, but we will not say that it is not crucial. Psychosocial support is not crucial. It is crucial. So as the level grows, the intensity of the mental health will reduce, but it's still crucial. And it is a complex concept because it depends on how or what relationship or what is the family status of the person or the child with disability, meaning that it could be that the closest person to the child with disability, it could be their sister, only their sister. So meaning that parents are not in the picture. They will come maybe later in the rest of the levels. Let's take an example of a child who is in a children's home. So we'll see that the concept will change. The tier will change. Level 1 for that child, it will change. It will be the caregivers who are working with the child at the care center. So it's a simple way of knowing the intensity of psychosocial support we need to give. But again, it's still complex because it also depends on how the person is relating with the people around or in what context is the person in. If they are in a family context, who are close to them, who are the next are in the next level, the second level, and who are in the third level. Slide 9. So if we look at a typical child and a child who is typical and a typical child, we see their parenting it is very different, and it is already visible that parents of children with disabilities already they have stress. They will experience stress in raising a child, their child, because it's a different situation. It's not a normal, as people like to call it. It's not a normal situation or a normal child, as people try to call it. Yeah. So slide 10. So some of the factors that may lead to stress for these parents or the caregivers, it could be the increased behavior problem with the child they are raising. So if it comes to a child with autism and the parent does not understand why is this child behaving this way, so this may bring stress upon them, stress. And then we have stigma from the family, stigma from the community, stigma from friends. So if the parent or the caregiver is stigmatized, then they will have some issues with stress. And then we have financial and social barriers. So it is already known that families of children with disabilities, they need extra care, medication, therapy sessions. So already this impacts on the parent or the caregiver. They need more financial support. So if this is not available, then it brings stress to the child. School transition, most parents, especially when it comes to our context in, for example, let me take Kenya, getting schools, transiting the child from home to school, it's quite a challenge, because they will not get schools that are supportive. They will not get schools that will be able to have resources to help the child with disability and the parent. So this brings again stress to the parent. Increased marital conflicts, which leads to increased divorce rate. Most of the parents that we've worked with in the low income areas, as I mentioned before, most of the families are single, they have single parents, especially moms are left with the children with disability, because there is already conflict, understanding why is this child has cerebral palsy, why is this child with autism, why do they have Down syndrome? So there's that blame game, and at the end of it, the fathers will leave. We have a small number that the mothers will leave, a very, very small number that the mother will leave the child with the father. But the highest number, 99% of it, of the situation, is the mother will be left with the child. So it brings divorce, there's break in the family. And then we have unrealistic expectations. If a parent is expecting that my child will be able to walk by the end of this year, and they are not able to even, their neck control is not there, they're not able to roll, they're not able to crawl, then at the end of the year, when it comes to December, that parent will be stressed, because I expected my child to be able to walk at this time. Why is my child not walking? So this will bring upon the mother stress. And maybe you can contribute to what other factors do you think will lead to stress for parents with children with disabilities? Just put it in the inbox, and we'll go through it later. Slide 11. This stress will in turn lead to poor physical health for the mother, because of the stress. They will neglect their self-care as mothers. They will have limited social interaction, because I have to be at home to take care of my child. I have to be with them 24/7. I cannot go to the women's group. I cannot go to church. I cannot engage with my friends. I cannot engage with my in family gathering. I cannot do that. So it will bring upon them limited social interaction. There will be disengagement, this disengaged parental behavior, as we've talked before. Some parents will run away and leave the child. And in the rural areas, actually, in Kilifi, in Muranga, as we do these workshops or this training, we find that most parents, even both parents, will run away and leave the child with the grandparents. So it is the child is under the care of grandparents. Another thing that will be resulted to will be neglecting the child's needs. So the parents will, if the expectations was not met, then at the end of that year they will be like, why should I take my child to for therapy if I am not seeing any changes? So they will neglect the child. And so, in the rural areas, mostly we find that children are put in a room and everybody goes to the farm, goes to other areas to go and just work, and they do not care of how that child has been the whole day. They are put in a room and left there, so they will be neglected. Nobody wants to take care of that. So if we look at parents' mental status, we need to look at grieving, because they are grieving that they have this child. So the reason why we are going through the grieving stage is because at the end we need the parent to accept that their child has a disability, and now they need to take steps towards understanding what can I help, how can I help this child gain their milestones or be productive or be able to be happy or increase their child's quality of life, things like that. So when we look at the stages, we have denial, we have anger, we have depression, we have bargaining, acceptance. At first, they will deny that I don't think this child really is not going to work. Yeah, they'll be in denial. They will show it. They will be frustrated and show it through anger. Maybe they will be frustrated that the nurse who attended to them 2 years ago, why did the nurse did not attend to me? They will have depression. This will result to depression, where they will be overwhelmed and they are helpless. Yeah, and then at some point they will start bargaining with God. Are you sure, God, this is what you want me to have? Are you sure you did not give me the wrong child? Yeah, so they will keep on bargaining. And then at the end, once they have gone through this stage, they will be able to explore acceptance. So once they explore acceptance, then it already gives them a step, 10 steps ahead, because now they are able to find for solution to their child's disability. When slide 13, if we expound that curve or that cycle of grieving, we will find that these are the stages that they will go through from their heart, and then they will adjust. At the end of it, they will adjust. But for parents of children with disability, it's not, this curve does not work that way, because sometimes they will have fear and they will bargain, they will go to loneliness, and then at some point they will go back to the first stage. They will be shocked. Are you sure this is what I have to go through? So for them, the curve is not as smooth as as we perceive it to be. In reality, the curve is so jumbled up because they will jump from one emotion to another. They will accept, they will go back to being shocked, being in denial, being so angry, angered, blaming people, blaming maybe the doctor, blaming the nurse, blaming themselves, blaming the husband, or the husband is blaming the wife. This is because of you. So in reality for them, this is what they go through. Their curve is never smooth. And when they share, when we are doing this training, when they share, you can feel that at some point they seem to understand that, yes, my child has cerebral palsy, and this is what is required of me to do. But again, they will go back to another stage and ask, "Hey, what happened? What did I do wrong?" So that means they will have an on and off acceptance in
Mary, I can't hear you all of a sudden.
I think you accidentally muted and went to the other.
hello. Okay, sorry. Yeah, we can go to the next slide. So how we take our caregivers and parents through the workshop is letting them share their life experience. What is their journey in discovering the child? What questions did they ask themselves? Did they get any answers? What people say about their child that hurt them. So this gives us the ability to know their understanding of their child's disability and their mental status at that point. Do they need more education to understand the situation? Do they need more psychosocial support during this process? And how it also gives us the ability to know how they respond to stressors raising a child with disability. So how will they deal with someone saying hurtful words? And then this will be able to be resolved. And when they share something that is amazing, when they share, it gives, if one parent shares, it gives the other parent the strength to actually share and also feel like I'm not alone. I'm not in a desert. I'm not alone. We are many, and probably my situation is not worse. There's worse situation. So I need to give myself the strength to move and carry on. Yeah. So in sharing, parents will cry, I will cry, we'll hug each other, but at the end of it, it helps the parent to smile at the end of it once they share. Next slide. So this is workshops in Somaliland and in one of SEP's projects in Nairobi. Next slide. So how, I think we've talked briefly on how they will manifest or what will happen so that you know their mental status is not okay. So when they're sharing, it's so hurtful that you hear a parent say, at one point I thought of suicide. Yeah. So they are at the point of giving up and they want to actually kill themselves. So, and then some of them they will say that I don't have to take the child to therapy. Why should I take the child to therapy? I want them to die. If that is the solution, I want them to die. And yeah, and some of them will be neglecting themselves. They will have imbalance in occupation. They do not want to take care of themselves. They do not want to do house chores, things like that. And then most of them will not have any jobs or work somewhere to go to earn a living. Their productive life is affected. So that means also they will have their economic status affected. And then we have loss of family and friends that influences their social life. most will share that my family, my mother or my sister, my husband or my wife, they do not want anything to do with me. So they will isolate themselves, the parents themselves. And then they have anger towards the child or towards anybody, even the community, even people they do not know. They do not want to see anyone looking at their child. They have guilt. Did I do something wrong to make this situation this way? They will doubt. And so, especially if we talk about doubting, you'll find that parents will run from one therapy place to another because they doubt, I think this is better than this one is better than this. If they hear there's a new way of dealing with cerebral palsy, they will run there because they have doubt in their mind. So that means they are they have stress. Next slide. So why should the parents give up? These concepts we have tried with the parents having multiple hats. The parent is wearing multiple hats. So maybe you can give your ideas of the multiple hats. You are a parent, but you are still someone else to your child. Like, for example, if it's a child with cerebral palsy and probably they have conversions, that means that parent is going to be a therapist and that parent is also going to be a nurse because they have to know when to give medication, at what time, what dosage. So they are wearing the cape of a parent, a mother, but they're still their therapist because now you as an occupational therapist will want them to carry on their home program. So that means they are also therapists to that child. So what do you think are other examples of hats that that parent is wearing while caring for this one child? So now, if they have all these hats, probably it's like 10 titles in one person. So I always ask the parents, so do you think if there's any chance of giving up or any time to give up? And all of them are like, no, I don't think I need to give up, because if this child loses that one parent, they're probably going to lose 10 people in one person. So there's no time to give up. Yeah. Next slide. So once we have gone through the process, once we have seen who they blame, why do they blame people, why do they hate people, why do they have anger in the society, why do they no longer go to church, why do you not associate with your family? So then we have to talk about coping mechanism. How do you cope with your stressors as a parent? Simple but strong coping mechanism for these parents, because most of them are in the low income area and they will not be able to get a therapist. Yeah, they will not get a psychologist to talk to them or give them solutions. So on the right, on the left side, we have some of the things that they say they use as parents. Talking to someone else, religious practices is a strong coping mechanism, because they feel like when they go to church or when they read the Bible, they get some answers, they get comfort. So that is really a strong point, and each group has given that as a very strong point. Taking walk, listening to relaxing music, use of humor, adjusting expectations. So if they thought at the end of the year the child will walk, they need to adjust. So most of them say, once I knew that this is not able to happen, then I gave myself time to think about it and lowered my expectations for my child. So, and then engaging in outdoor activities with their children or with their other people in their family. And then on the right side, we have some of the things that we try to practice with the parents, like mindfulness, guided imagery. they always like guided imagery. They are so happy after doing a practice on guided imagery, relaxation, physical exercises. I remember once we had a group of moms and we decided to do skipping the rope during the workshop. We just did skipping the rope and playing hula hoop. And one of the mothers was so sad she did not share during the workshop, but during the coping mechanism, when we wanted them to do skipping the rope, she was like the second person. And at the end of it, she was so happy and she was like, oh, wow, Mary, I came in so depressed. I was so devastated. I didn't have a job. But right now, I feel very good after doing this exercise. So teaching them the aerobic and anaerobic, cognitive restructuring, you as an occupational therapist can help the parent with that. And then we do parent education, like for special education professionals, they do parent education. They educate parents every month. They have a topic on something to educate the parents on. So this one is going to help the parents lower the expectation, understand their children, and be an advocate of their children and their own self. And then encouraging self-development, doing cooking as an activity to help you reduce your stresses. Next slide. So some of the parents will engage in maladaptive and adaptive coping mechanism. Maladaptive is any mechanism that is going to only give solution for a short time, and it might be dangerous for the parents, either physical or social aspects. So we need to help them understand what are the adaptive and maladaptive coping mechanism. Next slide. See, my time is almost up. I would like to also hear from you. What are some of the lasting solutions you think can help parents of children or caregivers of children with disabilities in coping with stressors of raising children with disability? So some of them are creating psychosocial support for the parents, having parents come together and decide probably in a month we'll be meeting for 2 or 3 minutes, 2 or 3 hours, and talk and listen to each other and be support for each other. And during this psychosocial support, some of the groups that we've had, they've already formed a little table banking, or maybe putting aside money to support each other. If your child is unwell, then we can come and support you. We can help you pay the hospital bill or something like that. So it has brought in some cohesion and it has helped them with their mental wellness, encouraging peer-to-peer education support, and then providing parental education on their children's condition, as we have talked before. That education will not go away from them. That will be a lasting solution. Then providing different supports, like medical support, material parents with diapers, things like diapers that are going to reduce the cost of raising the child. Yeah, next slide. Thank you so much. Next slide. Next one. Next. So if you want to get involved with Therapists Beyond Borders, we have the website. You can find my email on the website if you need to reach me. And if you need to be involved with Therapists Beyond Borders and learn more about Therapists Beyond Borders, you can go through to their website. Next slide. We have special education professionals. You can also learn from them. Those are their social handles, the website, and follow them on Facebook and YouTube. Thank you so much. I will let, is Salmin in? I'm not sure if Salmin is in. Okay, if he's not in, I can do the case study.
Yeah, I don't see him, Mary, sorry.
Okay. As we bring up the case study, I want to thank my directors from both organizations. They are present. Thank you so much, Carol. Thank you, Lauren. And thank you, Alexa. Okay. It's not a long one, but the story is important. So Jen is a 20-year-old mother of one. She dropped out of university after getting pregnant in her second year. This was a disappointment to her mother, watching her leave her education to take care of the child. With the birth of her child, Jane hoped to enjoy motherhood like any other. As 4 months neared, she was worried about her child's development. She consulted with the doctor and was referred to a community project that worked with cerebral palsy children at the church. Upon assessment by an OT and a PT, Jane learned that her child had cerebral palsy due to prolonged labor. In the few months to come, her child developed convulsions, which meant she had to put money aside for medication and take the child to neurology checkups every now and then. Jane's mother has been the caretaker for Jane's child and is experiencing burnout and overload. As a result, the mother has been blaming Jane for her fatigue and their relationship is strained. The father of her child bailed out and wants nothing to do with them. Jane likes music and knows how to play a guitar. She has joined the community at the church where the child receives therapy services and learns how to understand her child. So to our questions, we have question 1. What are the possible contributors to Jane's mental health instabilities? Question 2, what are some feelings Jane is experiencing? Give the basis of your answer. Question 3, what are some constraints and opportunities influencing Jane's mental health, wellness? Question 4, what are some coping mechanisms you can recommend for Jane to practice? Thank you.
Okay, so I am going to put you into breakout rooms. If you could all put your camera on for the 10 minutes that you're in breakout rooms, it really helps with the discussion. If you can't, we completely understand. We know sometimes connectivity is an issue. Thanks, everyone. All right, thank you, everyone. I hope you had a nice, rich discussion in your small groups. I'm going to go ahead and David, do you want to start and tell us what did your group talk about with question number 1, the possible contributions to Jane's mental health? Oh, you're on mute. Hey, David, you're on mute. Sorry. There we go. Do you mind starting over?
Yeah, there are a lot of different constraints, problems that could be adding to her problems. One was having to arrange for transport for the different doctors. And the other big one people mentioned was the burnout of the mother that was causing her increased stress and problems. Those are the things mentioned in my group.
Great. Ayika, did your group have anything to add to that?
Yeah, we had dropout from school could be one of the factors. The other one is having a child with neurological condition, which is cerebral palsy. Being a single mother, not having a partner to support. The child getting seizures most of the time, and financial constraints.
Sounds like it was a good conversation. All right, Ayika, I'll stick with you. What about question number 2? What are some of the feelings that Jane is experiencing?
Okay, so question number 2, we said she had a sad feeling due to feeling neglected, being a burden to her mother, and Also, she was frustrated with her child condition and whatever was going on in her life. She was depressed due to the burnouts and having to do everything on herself. She was also feeling guilty since she was told that her child had cerebral palsy due to prolonged labor. So she thinks that maybe it is because of her situation of the prolonged labor. That's why. So that is what we discussed on question number 2.
Great, thank you. Adonis, did your group have anything you wanted to add?
Well, we discussed about depression. Due to she's being a single mother, she has no support from family and even being criticized by her own mother because of the newly diagnosed child with CP.
Great,
And
thank
also
you.
because depression is a stage of grief also.
Right, thank you. David, did your group have anything to add to that?
It was mainly those same issues, but we focused on her feeling overwhelmed and her
Overwhelmed.
also feeling confused because things were not turning out the way she expected them.
Great, thank you. All right, Adonis, how about question 3? What are some constraints and opportunities influencing Jane's mental wellness?
Well, we talked about financial implications for constraints and opportunities like going to the church for support or playing the guitar.
Great, thank you. Aika, what about your group?
We said the same, the opportunity being part of the church, the opportunity of her child having to get some therapy sessions and the talent that she had for a guitar. And the constraints were relationship challenges with her parents and financial constraints and being a single mother.
Thank you. David, did your group have any additional thoughts?
Those are the main things. Again, the main focus, we focused on constraint was burnout from the mother's lack of community support. And then we hoped that there would be some opportunity for financial support or support from the rehab center in terms of helping her. Those could be opportunities.
Great, thank you. David, we'll stick with you for the last question if your group got to it. Were you able to discuss what are some coping mechanisms you can recommend for Jane to practice?
One was relaxation training, helping her to deal with the stress by relaxation. The other was to get more integrated in community groups. If there are groups of neighbors or even groups of parents with children with cerebral palsy, and maybe through that or separately get involved in some sort of craft activities that could be relaxing, but also might be income generating.
Great, thank you. Adonis, did your group have anything additional?
Yeah, we got some great ideas, like rebuilding the relationship with her mother, finding activities like cooking together, maybe visiting the church so they could get familiar with how other people with children with cerebral palsy deal with this new situation they are dealing with. Maybe she could play the guitar in a church chorus also as an activity to get relief from.
Great. Aika, did your group have any for this last question? No, okay. Well, this sounded like a great discussion. Mary, thank you so much for volunteering your time and expertise. We really appreciate you coming to OT Echo as a presenter.
Thank you. And I wanted to tell the group if they need extra training as occupational therapists on how to support parents, you can get in touch with us through TBB website. Yeah, and my email is on TBB website.
Great. Thank you, everyone.